Hello, I'm Will King, faculty member in the department, PhD in epidemiology, and the program director for the MSc in epidemiology. Welcome. My research is aimed at understanding modifiable risk factors for cancer, environmental exposures such as disinfection byproducts, ultraviolet radiation, air pollution, lifestyle exposures such as diet and physical activity. The goal is to understand exposure's increasing cancer risk, then ultimately to reduce cancer incidence by changing the prevalence of these exposures in the Canadian population. My recent research has addressed this in two ways. First, molecular epidemiology studies, which examine the relationship between environmental exposures and biomarkers of early carcinogenic effect. The rationale is that it's difficult to study exposures in relation to cancer outcomes, which may happen 20 to 30 years after exposure. By studying the earliest carcinogenic effects of exposure, such as oxidative stress or DNA methylation, we reduce that time scale and can better understand causality, dose response, and specific agents which increase cancer risk. We're also able to take into account genetic susceptibility, where the largest effects are observed in those most susceptible to these exposures. Second, my PhD students and I have been involved in a large pan-Canadian study looking at quantifying the number of cancers occurring in Canada that could be attributable to established modifiable risk factors. For example, physical activity, smoking, alcohol, diet, air pollution, radon. And what could be avoided in terms of cancer incidence if we could reduce population exposure. The goal is to highlight and prioritize cancer risk prevention strategies. I typically supervise 5 to 6 MSc and PhD students who would have workspace, research space here on the second floor of Carruthers Hall. I teach EPID 804, Intermediate Epidemiology, hopefully here in our new room in Carruthers Hall. I also teach EPID 901, the PhD Epidemiology course. We look forward to meeting you in the fall.